Cheryl Chase doesn't think so.
Being born intersex was going to be painful for me and my family, but it didn't have to be anywhere near as painful as it has been. And although the people who made it that way they're not evil and they didn't intend to hurt us, that was the outcome.
Because doctors judged baby Charlie's penis too short ever to have satisfactory sex, the assignment of female was a better choice, they told his parents.
They got permission from my parents to do surgery, and they opened up my abdomen and had a look and said, yeah, that's what we thought. These are basically female genitals, and the clitoris is large, and it's not male genitals at all. And the only problem with this kid really is that the clitoris is so large. So they closed up my abdomen and immediately removed my clitoris.
At the age of 18 months, much of Cheryl's capacity for physical sensations of pleasure had been cut away.
They came out of surgery and they told my parents, you don't really have a boy, you really have a girl. And you should change your boy's name to a girl's name and change to one that sounds similar so that he won't notice you did that. And keep him in diapers all the time so he won't notice that we removed part of his genitals. And move to another town and don't tell anybody where you went. And while you're moving, go through all your possessions and find everything that refers to his existence and eliminate it. Get rid of birthday cards, baby pictures, home movies, letters, everything. And just raise her as a girl. She's going to be fine. She's going to grow breasts when she's a teenager, and she's going to menstruate, and she's going to marry and have grandchildren for you. And everything is going to be hunky-dory.
And so the toddler's name was changed from Charlie to Cheryl. "40 years later, at University Hospital in Brooklyn, a couple we'll call Rick and Tina had their first child.
I just wanted a healthy baby. It didn't matter whether it was a girl or a boy for us. We just wanted a healthy baby. And Saturday morning, 2:38 a.m., I delivered.
When the doctor announced the baby was a girl, Tina was elated.
I was so happy.
But moments later, the doctor hesitated.
They said, it's a girl, and they said, oh, wait a minute. That was how it went. I didn't hear anything till, like, the next day. And then they came and explained to me that, you know, it could be a boy.
How do we assign gender? And how do we determine what is the gender of that individual? Well, typically in the past, it was defined by the microscope.
The chromosome and hormone tests that will help to clarify the baby's sex can take days, even weeks. In the meantime, new parents Tina and Rick wondered, what were people to be told?
And that was very, very difficult. There was people waiting on the phone while I was in labor, you know, and they all wanted to know what the baby was. My answer machine was, like, filled.
And the problem is a pressing one. Birth certificates need to be filled out. Is the baby male or female? How this question is answered shapes the baby's entire life.
I told my mother, just tell him it's a girl. Tell him it's a girl, 8 pounds, 9 ounces.
If it turned out later that the baby was a boy, well, the couple decided they would face that when they had to. The baby was sent to intensive care, and Tina and Rick were left to worry.
Katrina was born with only 2 openings. She didn't have a vaginal canal. It was like where the vaginal canal was supposed to be, it was like fused over with skin. It was just a smooth skin area, nothing there. It took about a week or better to find out exactly the sex.
Shortly after birth, a team was assembled to assess the sex of the baby. The first question was, what are the baby's chromosomes?
They did the chromosome testing, and she was XX, which is female.
But that wasn't the whole story.
They explained to me that her adrenal gland was malfunctioning. It would cause her hormones to escalate, to elevate.
Just weeks after conception, the baby's adrenal glands located on top of her kidneys started producing abnormally high levels of hormones that began to masculinize her body. The baby has a genetic condition called congenital adrenal hyperplasia, CAH.
We know that the patient with congenital adrenal hyperplasia has been exposed in the womb, in fetal life, to male hormones because that little female fetus, her adrenal gland was making male hormones.
Looks like an elongated urethra. This is part of the urethra inside?
After 9 days of tests, it was official. The doctors agreed with Tina and Rick. Their baby was a little girl. We'll call her Katrina. She was started on medicine to prevent her body from making male hormones, and early surgery was recommended.
It was obvious that her genitalia was enlarged, and so they explained that they were going to do reconstructive surgery.
Psychologically, it's best to operate on the genitals before 15 months of age.
Dr. Glassberg says early surgery is important for the parents, too.
The parents have to accept that gender assignment for it to be successful. So if a parent has a little girl with a big phallus that looks like a penis, can that parent be very comfortable treating that child as a female, dressing that child in pink? Well, there's a problem with babysitters. They can't have babysitters. What are they supposed to say to the babysitter? How open are parents willing to be?
And so, Dr. Glassberg says, even when it's not medically necessary, early surgery is standard in the United States.
We feel that a child to have a good gender identity has to have genitals that match their identity.
But it didn't work out that way for Cheryl. Her sense of whether she was a boy or a girl was never clear to her.
I think I have a gender that's different from most other people, and it's not exactly male or female. As a teenager, I was very depressed, and I was very angry, and I was very withdrawn.
When Cheryl started menstruating at age 13, her parents decided the ordeal was finally behind them.
I think what happened was my parents were living in terror that I wouldn't turn out to be a girl. And once I menstruated, they said, that's it, it worked.
He doesn't like it on his face too much.
But nothing about her surgery was ever explained to Cheryl. Increasingly confused and uncomfortable, at 19, she decided to research her medical records. It took 3 years to get them, but there it was in dry medical terminology. Sex, male. Then the words true hermaphrodite, and then name changed. The family secret was out. But what had been done to her was too painful to discuss. She pushed it away.
And I wasn't able to speak about it until I was 35. And then I was in the middle of a big emotional crisis.
In the eyes of the world, Cheryl was a highly successful business person, a principal in a high-tech company. She had moved to Japan and become fluent in the language. And then at 35, the demons returned. In crisis, she went to a psychologist who reassured her and set an appointment for the following week.
And I headed out of her office in a fog. by that night I was working out ways to kill myself. And then when I thought that of how sad and how awful that was, that nobody would know what it was about, I got angry. And I thought, if I'm going to do that, I'm going to do it in front of one of the doctors who did this to me. And I don't feel that way now, but that was the key, is changing from feeling hopeless to feeling angry.